now.
Perfect. Thank you. Good afternoon, everyone. Welcome to our Patient and Family Partnership Hub community conversation. Again, thank you so much for taking time off your day and joining us. Please know that we appreciate and value your time tremendously and that you are helping shape healthcare services for all our LA County community. Welcome to everyone. Bienvenidos a todos. In a minute, we'll do introductions. In addition to our PFCC partners joining us today, we have Aurora from Green Translations, who will be helping us today by simultaneous translating our conversation in Spanish and vice versa. And we'll be helping our Spanish-speaking patient family advisors who join in our conversation. Today, we have a couple of our members of our DHS team joining us and who will be sharing an update on our lab queuing system and exploring how can we best engage and describe our nurse advice line to our patients. As always, we're definitely looking forward in sharing what we learned here today with our broader DHS team. My name is Miguel Renteria. I go by Mike. I'm an improvement advisor for DHS, and my work evolves on patient experience and supporting our culture of patient-family engagement throughout our health system. Next slide, please, Laura. You know, I'll pass this one on to you, Laura, some of the Zoom features.
Sure, sounds good. We all been Zooming a lot lately, the last few years, but just in case, you have a couple options here to engage during the meeting. To put a question or a comment into chat, you can just click the chat button down on the menu. We do have a direct message set up. So if you want to direct message someone, or if you have a question specifically for somebody, you can just click on their name in the chat. I need to put live transcript on. I will do that right now. There we go. That's why we have the slide to remind us of these things. So live transcript is now available. There should be a CC down at the bottom on your menu. If you need live transcript, you can click on that. And then if you have a question or a comment during the meeting today and you don't want to put it in chat, you are more than welcome to come off mute and ask a question, and you can do that by raising your hand. There's the reactions button down there at the bottom. You just click raise hand and we will see your hand up and call on you. And like we said, we are recording today's meeting and that live transcript is available. And if you need to go back and view the meeting, we will have the recording available in a few days. Take it back to Mike.
Thank you, Laura. Our mission in DHS, well, here's a slide that shows an overview of our vision, mission, and goals. Our mission is to advance the health of our patients and our communities by providing extraordinary care. Our goals range from transforming our system to provide cost-effective care of the whole patient across the continuum, optimize clinical quality and patient experience, to have a high quality or a high-performing workforce, and ensure financial viability in support of our vision. Today, we're moving towards our mission by advancing on our strategic goal of providing high-quality care and patient experience through engaging your voice to help us in our work. Your voice, your views, your insights are incredibly important to our work. So we thank you so much again for taking time off your day and joining us here this afternoon. We are looking forward to having a rich conversation today. And I'll pass it back to Laura and our PFCC team who will help facilitate our discussion today.
Thank you, Mike. So I am Laura Jackson, the Community Director the Director of Communities for PFCC Partners. These are PFCC Partners' mission, vision, and values. Our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed. We want one that works with people and through communities as a partner in their well-being. Our values you can see here are equity, inclusion, diversity, collaboration, and solution focused. This is our agenda for today. So we are doing our welcome. We'll do some round robin introductions, and then Jeffrey will talk about the DHS lab queuing system. And then we also have Fiorella here to talk about the nurse advice lines. We have some fun hub communications to catch you up all up on, and a wrap up. So we'll do our introductions. So let us know your name, where you're calling in from, and what was the highlight of your summer. It's fall now, summer's over. And so let us know what your highlight was. I can start. I'm Laura Jackson. I am calling in from Eugene, Oregon. And my highlight of the summer was spending time out in the woods this summer. We went camping and we went hiking a lot, and it was a pretty good summer to be outside. Lindsay.
Yes. Hi, everyone. I was just chatting in that it doesn't feel like fall because it's still almost 90 degrees here. I'm Lindsay Kelly. I'm calling in from Sacramento, California, where it's going to stay 90 degrees for the foreseeable future as well. The highlight of my summer was getting back into live music and concerts. Is my favorite thing to do. And probably the highlight of all of that was taking my son to his first luau in Hawaii and seeing the live music there. So yeah, lots of highlights to celebrate.
Thank you, Lindsay. Oh, we have someone in the waiting room. Let's see, Ronald.
My highlights on the summer was, to discover, new things, with the family. Like, we went to the rivers, places and new camps. And now, we're ready with the new season that is coming. Now we're looking forward to be close, as a family, Thanksgiving, Christmas, all of the good things that are coming ahead. Those are the things that we're really looking forward to, to be close.
Yes, thank you. That's what we love about the seasons coming up with all the holidays. Thank you, Ronald. Joy, hello.
Oh, hello.
Hi.
My name is Joy. I'm from Long Beach. My highlight of the summer was going back to jazz festivals.
Oh, nice.
Yeah.
Nice. Thank you. Thanks for joining us today. Fiorella.
Hi, my name is Fiorella Arcidiacono, and I'm calling in from Los Angeles. And my highlight of the summer was introducing my 2-year-old granddaughter to the beach this summer. Just seeing her enjoy the water and building some sandcastles and being outdoors with her was very exciting.
Thank you. I love that. I love the beach. Thank you. Mike, you already did your introduction, but what was your highlight of the summer?
Highlight of the summer probably had been just barbecuing, I think, a lot, and having a lot of good eats, I think, throughout. So definitely enjoyed that. Thank you.
Summer is good for eating, for sure. Thank you.
Yeah.
And Jeffrey?
Hi, my name is Jeff Adelman. I am a project manager with DHS and live in Burbank, California. Highlight of the summer, besides cranking up the AC because it's so hot here. My daughter just turned 1, so celebrating her birthday, and watching her grow. She's now walking, so got to get my running shoes on.
Thank you for joining us, Jeff. Let me see if I got everybody. All right. Go ahead and we'll just keep it with you, Jeff.
Perfect. So actually, maybe for future, or if you want to update the slide, this is actually probably just a queuing system, because we're fully live with all of our labs, and now we're about 75% live with all of our pharmacies as well, too. And we're looking at actually expanding into our urgent cares as well. So these kiosks are coming to a theater near you. But yeah, I think you see some of the benefits of the queuing system of this kiosk. So nowadays, when you go for your labs, and when you go to pick up your prescriptions at the pharmacy, you'll instead of standing in line and waiting to go to a window or to see a staff member, you'll get a ticket from the kiosk. You'll get a you'll get a ticket. You can have a seat either in the waiting area, or you have the ability to, if you want to go grab a coffee, if you need to run to the restroom, if you want to sit in your car and listen to some music, you have the ability to not have to sit in a crowded waiting area. We've given patients the ability to wait anywhere, and to enhance on that, we've also we've recently gone live in all of our labs with the ability to use your cell phone. So the 2 bullet points on here of using your cell phone is with mobile ticket and texting, and I'll kind of demonstrate that soon in a bit as well. So we'll demonstrate mobile ticket and texting, and then yeah, you'll be able to use your phone to kind of manage your ticket, and you'll get updates through your phone. So after you get a ticket, you sit down. There's a TV in the waiting area that will display tickets numbers that are being called back to a staff member or to a window. And also there's a speakerphone in the waiting area that announces that ticket. There's some different workflows in lab and pharmacy, but that's kind of the general consensus of how the ticketing system works. With lab, we're live with patient feedback surveys. So when the lab visit is done, you'll get a text message with a link to a survey to fill out. And we are taking those survey responses seriously, and taking that feedback and trying to improve on the system. It is nice with having these electronic points of entry. It allows us to report on many things, and these reports does help us to optimize and manage the use of the system. So I'll kind of pause here to see if there's any questions of anything I mentioned. So three things I'd like to show you today that I'd like to demonstrate. Number one is how the kiosk looks today, and kind of our goals for the future. I'd like to show you how texting works, and maybe I could even I've seen the text millions of times. I'd like to almost pick on somebody here on this call, and we could send some text through them, as long as you have a unlimited plan. We do try to ask the patients, ask you guys, or at least kind of try to give feedback that definitely a good cell phone plan is probably, having a smartphone and a good plan is a good precursor for using those features. And then lastly, on the TVs in the waiting room, thanks for this image. We created this image as part of a video we created that plays on the TVs. We created this video on how to use the kiosk, and so I'm happy to play this video for you guys and show you what the video looks like and what patients are seeing in the waiting area. So that's kind of my plan for today. Any questions? Nope. All right. Let's see. Can I share my screen here? Okay. I don't think I can.
You should be able to now.
So this is this is kind of an end goal. This is not what is kind of live today, but this is how we're going to eventually, once urgent care is live, the goal is going to be you can walk up to any kiosk and be able to enter in for service for what you're here for that day. If you're here for lab, pharmacy, or urgent care, you'll be able to click that associated button. What you see today is after you click one of these buttons. So I'm going to go ahead and click lab and go through the process of putting in our cell phone number kind of, you can see getting a text. So let me go ahead. So select lab. When you select it, you then go, this is the normal screens we see today for lab. You always, the first screen when you go to a lab kiosk is you select your language. Next is if you have an MRN or a hospital white card, barcode card, we have a little image below of what it looks like. You could scan it at the kiosk. I don't have a card. I don't have a scanner tied to this computer, so I'm just going to skip this step. It does time out as I'm talking through. If somebody leaves up on a screen and walks away, we want to time out back to the home page. So I'll just go ahead and skip here. We're in lab, so it's asking for lab while you're here today for lab. I'll select blood draw and this clinic closed early today. Okay, it's okay. Let's do pharmacy. So for pharmacy, if I'm here to check in and I haven't been here today, I'm going to check in to grab a ticket. Let's skip and a ticket prints. This is what you see today when you go to a pharmacy kiosk. And you'll get a ticket. Normally it's like P001 or something to that effect. So let me go ahead and I'll do a different way of putting in a text message. I will. This is what staff, this is kind of the computer screen staff see when they log into the system. They will log in. They will see all the queues of patients that are in those queues. And once they see a patient pop up on the list, they call next. So I'm going to just go ahead and generate a ticket. And I'm going to go ahead and this is a way we can add a cell phone number behind the scenes and where it's stored to get text messaging. Does anyone want to kind of see how text messaging works and get a text? Mike, do you want me to use you as an example or Laura?
Yeah, Jeffrey, you could use mine.
Oh, what's your cell phone?
818-205-5732.
So the minute that a cell phone number is entered, Mike should get a text. I just triggered the text that should happen when you enter your cell phone number at the kiosk. Once you're entered at the kiosk, you'll go into a routine queue. And then at that point, if there's a lot of people in line, let's just say in this routine draw, there's 15 people waiting to get blood draws. You will get status updates as you continue along through getting closer to number one. But once you're first on the list and they call you, you would get another text. And Mike, I'm assuming you got some texts.
Yep. I got two texts. The first one that I got is ticket R200 now being served. And I just received another one now with the ticket R200 now being served at Draw Station 1.
All right, so I must have generated the first one incorrectly. When you first enter your cell phone number at the kiosk, I'll look at that. You get a text every time you get called. You get a text if there's a lot of people online, and then lastly, I'm just going to complete this visit. You should get one more text with a link.
And I just got that text with the link. It says, "Thank you for your visit. Please help us make your experience better next time by filling in our survey."
Perfect. And then on Laura's kind of bullet list was what's called mobile ticket. So there is a so there's an ability to, instead of using the kiosk, you can spell. That's the, just make sure that there's a name of the website. That's what. Sorry. So instead of getting a ticket in through the kiosk, there's an ability to scan a QR code next to the kiosk. That's up at some of our lab sites. So one of the sites that it is up is at like San Fernando lab. So we've got that QR code that actually bypasses them having to choose a location. So it comes right here. You say you're here for check-in or blood draw, and we're actually programming it in the QR code to select that for you. And then you have an ability to also use your phone as this ticket, or you can get text message updates as well. I'm going to skip it. I'm just going to use my phone as a ticket. So I'm going to skip this step, and now I have a ticket. And so it shows me I'm second in line as the lab calls this first person. It'll actually show me moving up to first in line. So this is kind of a nice kind of virtual line that you're in, and eventually you get called. So wanted to show that. Lastly, not sure my allotted time has passed, but I wanted to show the video. Wanted to show the video that is being played in the labs today. We're in the process of creating the video for pharmacy, but wanted to show that.
Go right ahead.
And as Jeffrey brings up that video, and just for context for everyone, so Jeffrey joined our patient family partnership hub very early on in this work, and really kind of took, the insight learned from the group provided at that time, and really kind of, incorporated the insight learned into the project. So this is really Jeffrey kind of reporting back and really kind of showing, the work that was put together, not only by his team, but also from the patient insight learned here. So thank you again, Jeffrey, for following up.
No problem. Can you hear the sound of the video?
Let's see.
No.
We cannot.
No.
Okay. Some of these Zoom sound controls are always a little tricky here.
Yeah.
Usually when you share the video, you have to click share sound.
Let me try that again.
You might have to reshare. Oh, good.
Is this better?
Yeah.
Welcome to our lab. To make your check-in process easier, you can use your cell phone to scan the QR code or use the kiosk. Please remember to sanitize your hands both before and after using the kiosk. Please start by selecting your language. Click your language to move to the next screen. This is how to scan your MRN card. Don't worry if you don't have a card. Skip. Except if you are at LAC USC, Humphrey, or High Desert. You will have to go to Cheyenne, also known as Health Information Management, or registration to get a card and come back to the lab. Your MRN card can be used at our facilities. The survey here for today. If you have to drop off a specimen and also have your blood drawn, please press blood. Take your ticket and watch the TV monitors for your number to appear. The speaker should announce where you are to go.
L513. L513.
Remember, we are here to serve you. After your service, please use the device at each phlebotomy station to provide immediate and direct feedback. You can also provide your cell phone number at the kiosk to be sent our quick 2-minute survey via text message. Your honest opinion is appreciated. Thank you for your help.
So I think that's all I had to show you. Just kind of open up the floor for any questions you have.
Thank you. We did have a question in the chat from Lindsay. She asked if that video is available in any other languages.
So yes, so we played in English and Spanish on the TVs, and then we actually I think I have this folder showing we actually have 3 or 4 other videos both in English and Spanish. So that was a 2-minute video. If it played on loop for 24 hours a day, staff would get annoyed, and patients who are there waiting for 20 minutes would probably get annoyed. So we have the video's 2 minutes. So double it in Spanish is 4 minutes. We have another couple of videos on the patient portal and a smoking cessation video that plays. So we have about 12 minutes of content that plays on loop.
Great, thank you. Do we have any other questions or comments, or has anybody used these kiosks before?
I have used it before for a blood test, and it seems to be so easy.
It's good to hear.
I'd love to hear that. Thank you.
When is it going live in urgent cares? Asks Fiorella in the chat.
We're obtaining funding right now. It's been approved by COOs, so we're still looking to kind of get on the docket there for funding, and then we'll begin to start to develop it and move forward. I'm probably at this point I'll look until early 2023. I mean, just a best guess. What we're hoping to have all of our pharmacies completed by the end of the year.
Any other questions or comments? No. All right. Well, thank you for sharing, Jeff, and thanks for coming back and sharing what you all have done with kind of the comments and suggestions given the last time you were here. So it's really exciting to see.
Oh, I have a quick question.
Yes, of course.
How many kiosks will there be per clinic site?
We do interviews with each clinic in each location, so it just depends on layout of the clinic and location. It's usually between 1 and 3 per per service. So maybe 1 in the lab, 2 in the pharmacy. And looks like we're shooting for about 1 or 2 per urgent care location.
And do you have an alternative for someone that's not used to using the kiosk? Like what they have now is just to pull the ticket. It's a little machine and they call your number. But what do you do for someone that's not very tech savvy or may even have a difficulty reading or dealing with the screen?
Yeah, I got you. Yeah, we've tried to strategically place it in locations where staff can kind of monitor the kiosks. Some sites are a bit more short-staffed than others, and they do have some trouble there, and some patients get stuck. But our goal is to try to strategically place it in an area where staff are by that can assist the patient in getting a ticket. There's also an ability to for the staff through the software to generate a ticket and print it out on their side for the patient as well.
Thank you.
Thank you, Joy. All right. Well, again, thank you, Jeffrey, for joining us today and sharing, and we look forward to seeing what comes of these kiosks in the future.
Well, thank you for having me, and should any other questions arise, happy to answer those questions. And I know Laura and Lindsay and Mike will be talking for some other reasons later too as well. So
Thank you. Yes.
Thank you, Jeffrey. Thank you.
All right. Let's see here. We will go ahead and move on, and I'm going to pass it over to Fiorella to talk about the nurse advice line.
Great. Thank you so much, Laura. Will you be moving the slides, or would you like me to share my screen with it?
Yes, I'll move it. Just say next slide and I can.
Okay, perfect. Sounds good. Thank you. All right. Well, thank you very much for the opportunity to come and speak to all of you and get your insight on something that we've here at Health Services we've launched. I did introduce myself. I'm Fiorella Arcidiacono, but I didn't mention where I work. So I am at the Office of Patient Access with LA Health Health Services, and I oversee the contact center for the Office of Patient Access. And in there, we have several programs where we provide access to care to patients. One of them, which is our newest program line, which is called the Nurse Advice Line. And really, this Nurse Advice Line is the first time that DHS has had a nurse advice line that covers all facilities across all our hospitals and our clinics. So we're able to receive calls from patients, any of the patients. So it's a centralized line. So next slide. And so the nurse advice line, again, as I mentioned, it does service our patients that are in panel. So there's, they have an assigned doctor, or those that are uninsured or underinsured, and it's specifically for primary care. We do have a system that we purchased. It's an application called Kiona Health that we implemented in August of last year. And in there, it has over 600 evidence-based clinical guidelines to help us, our nurses, triage patients. We're staffed with about 12 nurses right now. Their backgrounds range from ICU, emergency room, ambulatory clinics, and other inpatient settings. So we have a good resource of a variety of backgrounds. And then we're open Monday through Sunday from 7 a.m. to 7 p.m. And that does include the holidays. Next slide. So we've started our, the way a patient accesses the nurse advice line is by calling their patient access center and requesting, at times they might not be feeling very well and they're requesting an appointment to see their provider. Sometimes they're not able to, there might not be an appointment available that day or at the day that the patient is interested in, and they're offered the nurse advice line so that our nurses can go ahead and triage the call and provide that patient specific information regarding their symptoms. So this is a flyer in English, and the next one is in Spanish, that provides the patient some information on when they could call us and the type of scenarios that may occur, and then our toll-free number, and then the information on when we're open. And we also, we support adult and pediatric calls. So this is our English flyer. And the next one, the next slide, please. And this is our Spanish flyer, introducing the line. The next slide, please. Okay, so again, as I mentioned, we do receive calls from adults, and what we've encountered recently this past year, being it's our first year with all of these clinical guidelines and the type of calls, a lot of it has been very related to COVID-19 symptoms, right? So we have been triaging, speaking to the patient, gathering their information, gathering their symptoms, finding out, you know, how are they feeling, and then with our clinical judgment and our and the use of these guidelines, we can go ahead and ask them specific questions and figure out what it is that they need. So our top ones have really been COVID-19 symptoms, which a lot of them, most of our calls have been either diagnosed or suspected. And then we're starting to see now, as COVID has decreased, calls related to patients having abdominal pain or you know, regular cold-like symptoms. We also have information on medication refills. So it's starting to become more of a variety of type of clinical calls we're receiving, which is wonderful because the nurses are really excited to be able to, you know, interact with the patient and help them with a variety of symptoms. For pediatrics, we're also receiving, you know, calls related to COVID-19. Mostly those are, you know, children with their parents calling in with, you know, high fevers and specific. When the nurse speaks to them, they're able to identify specific symptoms that help them understand which direction to go. The other thing is, you know, fevers, rash, redness. Those are other more common symptoms that we're receiving from our pediatric population. Now, you know, once we've determined what the outcome should be, or what we call a disposition, we have several things that several ways we can provide assistance. One is by assisting the patient to receive or to schedule an urgent care appointment within the 3 days that they're calling us. So either that day, the next day, or the following day, either in person or by telephone at any of our 7 urgent cares where we have access to schedule. So that's been a great flexibility. Again, it could be in person or by phone. And I think a lot of patients, especially during those that have COVID symptoms or are feeling really, you know, not very well. And it's definitely something that can be managed by phone. That's been a really very, very helpful for the patients to be able to access that care and speak to the doctor who would call them and discuss their additional symptoms and maybe prescribe medication if needed. Another outcome that we do get is recommendations maybe to follow up with their primary care doctor in 1 or 2 weeks. There's a percentage of calls that come in that they really don't need to be seen by a provider, but through our nursing and our guidelines, we're able to provide very specific and detailed instructions on specific home care and how to manage their symptoms. And then for those patients that we do get where it's imminent, they definitely need to be connected to 911 or they need to go to an emergency room. So first of all, for those that are needing an emergency 911, we never tell the patient, hang up and call 911. We always communicate with the patient, and we will do a 3-way call, get the 911 operator on the phone, have the patient on the line, discuss the situation with the 911 operator, and then wait on the line with the patient until emergency services arrive. And usually, and every time emergency services is there telling us, I'm here, you can go ahead and disconnect. So that's been extremely successful. And then for those situations where they're not immediate attention is needed and the patient should be going to the emergency room because of their symptoms, then we do provide them the information of some of our sites, or we tell them to please go to their nearest emergency room, depending, where they are from where they're calling us from. Next slide, please. And then, when should a patient call us, right? They can call us directly to our main line or through one of their patient access centers whenever they feel they have symptoms and they want to speak to the nurse and they need some advice, or they have questions regarding symptoms. They can call us when they're not able to not able to obtain an appointment with their primary care doctor. Maybe it's a little later in the afternoon. There might not be an appointment available, and since we're open till 7 p.m., they could definitely connect with us for that service also. And also, if their symptoms are not improving, they definitely could give us a call back, and we'll go through, reassess them, and help them disposition to where they definitely would be at best, the best thing for the patient. Next slide, please. So the reason for me to come, one of them was that I had discussed with Laura and Mike was, we've done this for about a year. We kind of launched slowly over several months into several sites. And we've put advertisement in our DHS website, and we've put it in the portal, the LA Health portal, and other areas. We have our flyer. We're going to be doing a lot more advertisement. But what we've noticed is there's some hesitancy of, speaking to the nurse in the nurse advice line. So kind of wanted to see what maybe some of your recommendations might be to some of these questions that we're getting. So we've observed that there's a decreased interest in connecting with the nurse. They kind of shy away when they're offered to speak to the nurse in the nurse advice line, because many of them have built such a wonderful relationship with their nurses in the clinic, and they feel that relationship is there, and it seems like they're more comfortable going that route. But by doing that, we don't get the opportunity to assist them right away and kind of provide them the information they need and triage them and do all that. So we really kind of want to find a way of how we can merge that, or fill that gap. Next slide, please. And then, and the other thing we were wondering is, when we say the words nurse advice line, how does that sound to you? Is it something that is, do those words, is it very clear that, a person can come, can call us, or should we change the advertisement of nurse advice line? Should we, what does it mean to you, and what's the impression? And would it interest you in calling us, by knowing that there is a nurse advice line to triage your symptoms? And then, any suggestions you might have on how we could introduce it to our patients. And I know that was quite a bit of questions, but that's, kind of what we're thinking. And so we just kind of wanted to bring it to this group. And, if you maybe don't, want to give it some thought, I'm sure Laura and Mike will provide us some feedback, over the days or weeks. And sometimes I think too, like by presenting this and then, we go home and we think about it, there might be something that may trigger and help you, that might say, oh, okay, maybe if we did this, and then we can get that feedback later on too. So again, last slide, please. Laura, I'm not sure, there should be one more slide. Oh, great, thank you. And so then this is our toll-free number. And we are open Monday through Friday, 7 days a week, and on the holidays. So that's a really big perk because our clinics are closed during county holidays, but our nurse advice line is definitely open. So that's something that we're really going to market, and we're going to be putting flyers and banners in the primary care clinics across all of health services so that patients become more aware as they're maybe waiting in the clinic or walking around the facilities. They'll be able to see this advertisement. So thank you so much for your time.
Thank you, Fiorella. I do want to go back, if I can, to some of these questions here. We have a few minutes. If anybody wants to answer any of these, so how about the first one? When someone says nurse advice line, what does that mean to you? What is your impression or expectation of that? I'll go to Joy.
Question 1. Well, I think that's okay. It's pretty straightforward. It tells you exactly what you would expect, advice, as to what to do. So I think that's okay.
Thank you. And so you think that the name nurse advice line is fine, it's pretty straightforward.
Yes.
What about, if I go over here, have you used the nurse advice line at all?
No, I have not. But going back to, I think, question 3.
Sure.
How should the nurse advice line be presented?
Mhm.
I think maybe when a patient's being seen by the LVN or the assistant, what have you, they should let the patient know that there is a nurse advice line, because a lot of patients have like complicated medical conditions. So it's like not always one thing, and sometimes they have questions, so they probably don't even know that this is available. And I think maybe when they're with the nurse and the nurse is talking to them, maybe the nurse can just talk about the advice line and maybe hand out a card with the number on it so they can call when they have questions.
I love that idea. I think that will also kind of help what Fiorella was saying, the hesitancy to use the nurse advice line, because people are hesitant to ask questions or talk to somebody outside of their clinic. So maybe if someone in their clinic gave them, I like the idea of like a little business card or something with the number on it, they know that it's a safe place to call and recommended by someone in their clinic.
Yeah, because the first thing a person is going to do is call their doctor. Right. And the doctor only has limited appointments. And sometimes you have to leave a message with the front desk or whatever. So I think having that is like another way to just get a hold of someone.
Mm-hmm. Thank you, Joy. Any other questions or comments about the nurse advice line? All right, well, thank you so much, Fiorella, for coming by. And like you said, we'll put this out to more hub members as well, and hopefully get some more advice and ideas for you. And we'll be in touch.
Thank you very much to everyone. And Joy, thank you. I've jotted down all of your recommendations, and it's great to hear that feedback. So thank you very much. I appreciate it.
Thank you. All right, with our last few minutes, we have coming a new hub website and community forum. As of right now, our community forum is on the PFCC, or the PFA network website. So we are looking to, or we're in the process of creating a community forum specifically for the LAC DHS hub. So keep an eye out for that. We will be sending out links to the new forum, and we look forward to connecting with all of you in between our monthly meetings and sharing resources and questions and answers and all kinds of stuff in between our meetings. And then we do have a new engagement opportunity for you all. The Ambulatory Care Network, ACN, is looking to, they have their joint leadership retreat on October 12th, and they are looking to kick off their meeting, their retreat, with an uplifting patient story involving the ACN. So this will be virtual, 10 to 15 minute patient story. They want to uplift their leadership group as well as showcase the importance of working as teams that provide excellent patient care. So if you have a story that you'd like to share with the ACN at their retreat, feel free to get in touch with us, either myself, Mike, or Lindsay, and we will get you all set up with a prep call, and you can share your story. And that's it for today's community conversation. Our next meeting will be back on Mondays. Thank you for joining us today, even though it was rescheduled. So our next meeting is Monday, October 24th at 3:30 p.m. Pacific, and we look forward to seeing you there. My email is down there at the bottom if you have any questions or if you're interested in that ACN engagement opportunity. We'll see you all next month.
All right.
Thanks,
Thank
everyone.
you.
All right.
Thank you,
Good
everyone.
evening, everyone.
Have a good evening.
Have a
Thank you
good
so
one.
much.
Right.
Thank you.
Thank you.